Give me one moment. Okay. All right. So we're excited to speak today about the basics of the immune system on all sorts of things about how the immune system works. We won't go into a ton of technical detail, but it's a lot that we can share with you that we think is very important to help understand this amazing thing that we do call the immune system. Uh, I will end there. And Kristen Kelly, would you like to start with this?
Yeah. Thanks for being here, everybody. I'm Kristen Gabriel, one of the nurses, and Kelly O'Connor's here too. And you're gonna kind of the format you're gonna hear is us taking some turns sharing information with the lovely Dr. Navsaria, jumping in with some extra information. And he's also going to be helping with the chat today. So speaking of the chat, let's just start for a minute. Share in the chat what one fact or belief that you have heard about the immune system is. So this could be something you know is a fact, something you've heard but you're not sure of. Something, for those of you who listen to our podcast, something Grandma Malone type figures have told you that you think just sounds maybe not right. Just please share your thoughts. An apple a day keeps the doctor away. That's a good one. All right, so some interesting things coming through here. I think we'll move on to the next slide. Feel free to keep throwing some things in there. I think some of these are in our slides that we'll be able to talk about. And then if we have some time throughout, Dr. Navsaria might pop in and be able to address some more of these. So thank you so much to those of you who shared. So we're going to start with a few did you knows. So, did you know that there are multiple parts to the immune system, but each one of them works differently? And we're going to talk about those parts in just a moment. Did you know that the immune system works almost continuously each and every day? And what's really cool is that most of the time we don't even notice. And I think that that just shows how great the immune system really is. But also, did you know that too much immunity can be a bad thing? So, some of you may have heard of something called an autoimmune disease. Lupus or rheumatoid arthritis are a couple common examples of that. And that's when your immune system is actually attacking your own healthy tissue. So, it's not functioning properly. Next slide, please. All right, so those parts of the immune system, we have what's called general immunity, and we also have what's called specific immunity. So, general immunity is kind of the jack of all trades. It's going to respond to everything, whether you've been infected with that before. Um, but because it responds to everything, it doesn't have a really specific targeted response to an illness. By the time general immunity kicks in, you're already infected, you're getting symptomatic, which is actually a sign that your immune system's working. And again, it doesn't require prior exposure to work. So that general immunity covers us for everything. But then we have what's called specific immunity. And this is what our body needs to develop. So typically, we need to be exposed to whatever the offending agent is, the virus, the bacteria, one or more times in order to develop this. And this part of the immune system, our body is able to really target a response. So the next time we get infected with it, we might never even know we were exposed, or, we might get a few symptoms, but not as many. It really can vary. But our body is able to fight that a lot more directly. Next slide, please. And of course, we can't talk about specific immunity without talking about the wonderful invention of vaccines. So, for many of you might already know that vaccines and specific immunity actually go hand in hand. Vaccines are helping us to develop that immunity to a potentially dangerous viral or bacterial illness without the risk of actually getting the illness itself. The vaccine is showing the immune system a small part of the virus that's not going to be dangerous. And then the body can target that immune response. So if we are exposed to that particular illness, then we're able to fight it off without getting really sick or sick at all. And many of you are familiar with booster vaccines. We talk about that yearly flu vaccine or that yearly COVID booster. Those are giving the immune system a reminder about how to fight those specific illnesses. And sometimes the formulas change just a little bit to help us fight kind of a different strain of those illnesses. Next slide, please. So this is a really cool chart. You'll notice it's specific for the coronavirus, but you could really look at this chart and think of any type of viral illness. So it shows you from the time of exposure where the viral load goes up. That's when the virus is replicating inside your body. That's also when that general immunity finally kicks in. So you see where you're infectious, you're showing symptoms. That's our general immune systems working really hard to get rid of that virus, get that out of our body. Once we're done, our immune systems are kind of finishing up, then we're less contagious, we're recovering. Now, I want to make a point that if we have specific immunity to whatever the infection is, that curve is not going to go up nearly as high, or maybe at all. Depending on what it is, we might just have a few symptoms, be slightly infectious. Again, we may never know that we were infected, so it could just be a completely flat line. Next slide, please. I'll turn it to Kelly.
Hey, I know we're working on getting the slides to be a little bit bigger, so let us know in the chat. Just speak up if those slides flip to the right view, and we'll keep working on that in the background. But for the respective time, I'll just kind of keep talking about our immune system development. Next, we want to talk about what is happening with newborns and with infants and their immune system. So this it applies to the infants we see that you take care of, and also when you yourself were an infant. Like Kristen was talking about, our immune system needs exposure and practice to germs of the world in order to build tools, in order for the immune system to work. So a newborn baby, like we can all imagine, has not had a lot of time to build those tools of its immune system yet. Yet is being exposed to the same world you and I are as adults, with years of exposure and tool building of our immune system. So we might think like, uh-oh, what are we doing with this infant? Good news. There's this type of immunity called transplacental immunity, which is a fancy way of saying that a mom's antibodies or the tools that they have built over their lifetime are passed through the placenta into the like in utero baby. And then when the baby is born, they have all these tools that the mom has developed over their lifetime. So that's why a newborn baby doesn't get immediately sick, right? They have all these tools that they've kind of like inherited from their mom. Um, so those tools that the mom creates come from like from them being exposed to the world, but also from her being vaccinated. So really kind of a cool thing. And there's new vaccines coming out for RSV and pertussis, which I'm super, super thankful for because RSV is it's something that like you guys know a lot of infants would get, and it's kind of like a new science and vaccine. So it's really exciting time for that. And we are strategic about the timing of that, so things are passed along like at the right time. We can go along to the next slide now.
If I could just comment real quick, Kelly. Yeah, this is really great because, RSV is not a serious illness for the majority of healthy adults. And same with whooping cough, but now by immunizing mothers, we're able to pass that immunity to the baby across the placenta and gives them some pretty good immunity for a number of months. So this is something that they've been working on for a long time, and it's nice to see that it's finally available.
So next we'll talk about what happens over the course of the first 6 months of an infant's life. So these tools that are passed along from mom to baby early on, they kind of come with like an expiration date. They kind of break down on their own, and we see that breakdown starting to happen around 6 months. So you might notice in your classrooms that 6-month-olds tend to get a lot more viruses. This is expected and normal, and is the baby's own immune system kind of taking over and learning about the germs and the world around it and learning how to respond for itself. And it's a beautiful thing because by the time a baby is 6 months old, it's a little bit chunkier, right? It has more reserves. So if the baby gets sick, it's not quite as big of a deal or worrisome as if a brand new newborn was getting sick, where its airways are structured a little bit differently, and it doesn't have as much reserve to like fight off those germs as a 6-month-old would. So it's kind of a beautiful evolutionary thing there. I love it. So one of the reasons that's just like one of the reasons we see 6-month-old kids getting sick a lot more. Um, Anything to add there, Dr. Nafsaria?
Nope, you nailed it all.
All right, we can move on to the next slide then.
All right, now we're going to talk a little bit about allergies. And just for fun, any ideas, and you can share in the chat, what is the relationship between parasites and allergies? Any guesses? All right, let's go to the answer. So part of our immune system is actually meant to fight parasites, but it's not a use it or lose it kind of thing. It's when this part goes unused because we don't have many parasites, allergies can actually develop. Next slide, please. So why does this happen? Again, that unused part of the immune system, it needs something to do. It's not going to just go away. So it ends up causing allergies and asthma. And many of you may be aware that allergies are really just an exaggerated immune response to things that are not dangerous to us, also known as allergens. I saw somebody mention dust. Yep, common allergen. Seasonal, very common. Pets, foods, there's all sorts of environmental allergies. Um, and in third world countries, these conditions are actually very rare because they still deal with these parasitic infections. So this particular part of the immune system is still being used for its intended purpose in these countries. But again, here in the United States and other developed countries, it's not. And so we end up with a lot more allergy issues. Next slide, please.
Before we move on, I see a
Oh,
quick question in the chat that's really relevant. Any way to prevent these allergies from developing? And that's a great question. And we don't have a guaranteed way, but there's some thinking that early exposure to certain things that are common allergens may actually prevent allergies from developing. So we know, for example, that children who grow up on farms and who particularly are in and around barns and other animal, livestock, et cetera, areas are much less likely to develop common allergies. Those who are on farms but kept away from those areas have a higher rate of asthma and allergies. And then folks like myself who grow up in big cities are nowhere near this stuff, and I have quite a few allergies and so on. They're also working, like, for example, with peanuts, that small exposure to tiny amounts of peanut in infancy. And there's a talk. Don't do that on your own. Please, talk to your pediatrician or the child's primary care doctor about that. They that early exposure to small amounts of peanut and or other common food allergens may actually reduce the risk of developing allergy to those sorts of things because the immune system is kind of hitting it when being exposed to it when it's still at a phase where it can still, quote unquote, learn that this is not something that your body needs to flip out about. And that part of the immune system, in case you hear it, sometimes it's called the IgE system, that is devoted to parasites and is implicated in all this stuff that happens around asthma and allergies.
Are the slides still up there?
They are.
Okay, great. Um, and I lost the view here. So I think we're talking about now supporting the immune system. So we can go onto the slide now. How can we reduce the risk of getting sick? And I kind of want to take a moment to talk about this in like an age-dependent way. So, like we were talking about before, age 6 months to about preschool years, kids are going to be exposed to a lot of stuff, and their immune system is really working hard to develop and grow. So it's really common to see many viruses in that time frame. That is very normal. We expect that. Something I do want to emphasize for all ages is immunization is the most important thing we can do as a society, as an individual, to reduce the risk of getting sick and to reduce the risk of getting like dangerously sick. We've put a lot of effort into developing these vaccines to reduce the risk of getting those really, really harmful illnesses. So the illnesses that we see typically now between ages, 6 months and preschool, a lot of common colds, a lot of things that aren't typically dangerous for kids to get. So I just wanted to take a moment to highlight that. Um, Other things, baseline things that we can do, and this is again age dependent. Washing your hands, wearing a mask. That's more for like us as adults, right? We have the ability to assess around us, like, ooh, my coworker is kind of sick. I'm gonna throw on a mask here, just to reduce the exposure that we are getting of viruses. Around us. We saw that a lot with COVID, right? A lot of adults were wearing masks, especially if they were noticing someone else was sick. Granted, 2 and under cannot wear masks, and even 2 through 5 or 6, it's like really like we're not going to keep that mask on our face, and that's okay. Their immune system is growing. That exposure isn't necessarily super harmful to them. So just wanting to emphasize for the population we're talking about today, the most important thing that we can do for them is keep them up to date on their vaccines. That's the absolute number one thing. Um, and I do want to take a moment too to talk about like seasonal vaccines. Like there's a reason there's some viruses that change every year, like the flu. So that's the reason we need to get vaccinated against that every year, and why every kid should be vaccinated against the flu and COVID-19 every year. And there are some illnesses that don't really change. They've kind of like, for example, chickenpox is a vaccine we don't have to get very frequently because that virus doesn't mutate. So our immunity against it doesn't need to change that much, if that makes sense. Anything to add there, Kristen or Dr. Nafsaria?
None, carry on.
Awesome. We can go to the next slide then, which are what are ways to help the immune system work properly? Again, we can kind of talk about this in age dependence. Us as adults, having like a well-balanced diet, exercising, sleeping enough, those are all things that support our general health. And have our body kind of prepped and ready to be strong to fight off viruses and stuff like that. For kids, these things are also important. Being overall relatively healthy, it just looks different in the 0 to 5 range, right? Like a kid isn't going to sleep perfectly every night. It doesn't mean that they're going to catch a cold the next day. It's just overall, how are they growing? How are they doing? Are they on their growth chart properly? Those are the kind of things that we think of. In terms of nutrition, an important factor here is being like adequately hydrated, not overly or underly. We don't want to go overboard with fluids, but the way part of our immune system works, it has like a set of filters. So just being adequately hydrated is a factor in that. Nutrition wise, like I said, having a healthy, balanced diet, depending on age, for an infant, that's going to look different than a 50-year-old, just being well balanced so that your body has the tools it needs to build proteins that make up the immune system that kind of work to fight off those germs in our environment. That being said, there's a lot of talk out there about like expensive supplements. You can buy this fancy product or that fancy product for the low price of $50. Reality is there's not a lot of research or science supporting that. The most important thing you can do is just have a well-balanced diet. Um, any thoughts about that?
Yeah, I'll just add in that you'll note that it says ways to help the immune system work properly. That doesn't mean it's going to make the immune system work better than it's designed to, right? So good exercise, good sleep, good nutrition means that everything works that it as it should, but it does not mean that you can magically, through some magic exercise or magic sleep or magic nutrition, make it work even better. If there's a particularly bad illness out there, or any illness, honestly, even with proper exercise, proper sleep, and proper nutrition, you could still fall ill from that. These are not magically protective against everything. However, if you don't exercise and if you don't get good sleep and you have poor nutrition, your immune system won't work too well, and that means you'll get even more illnesses that are out there.
Well said. And we can move on then to the next slide of how can I make my immune system work better? I sound like a broken record here, but vaccination, number one thing that we can do for everybody. It is kind of a miracle that we can like get our body trained to fight off these life-threatening illnesses without ever having the risk of our life threatened. It is truly a miracle and something I'm thankful in my job every day. Um, the other thing we do is training, so exposure. So I'm talking a lot about the 6 month to 5-year-old time frame. They're going to be around their friends. They're going to be exploring the world with their hands and their mouths. They're going to be exposed to things. This exposure will, prompt their immune system to start building those tools and working. They're going to get common colds, and it's okay to be sick in that time frame. Um, Same goes for adults. It's okay. We expect that adults will get sick a handful of times every year. But as an adult with the ability to wear a mask and stuff, if there's like a particular, there's like a wedding coming up or something, it's okay if you're in a public place also to be like, I want to decrease my risk of exposure to a virus. I know that a lot of times when I'm touching surfaces and then eating something, that's a way we can get exposed. I'm going to wash my hands a little extra, or the person on the bus next to me is coughing, I'm going to throw on a mask. Those are also appropriate things to do. It kind of depends on the individual and like how you like to experience the world. Another thing for all humans, kids or adults, that our culture isn't great at is once you are sick, once you are experiencing those symptoms, it's really important to rest. It's important to sleep when you're tired. It's important to stay as hydrated as you can, even if you don't feel good. Age-appropriate things that support resting. All humans could use a humidifier. If infants are breastfed, breast milk is another way that antibodies are passed along from, adult mom antibodies to baby. So that's kind of a cool thing if that's available. If it's not, that's okay too. Another way to support feeling better for adults, I'm a big fan of like saline rinses through your nose. They're just resting, staying hydrated. Again, not a ton of fancy medicines or supplements. There's not really a magic pill. Your body's just kind of got to go through it. And then, Dipesh, or Dr. Nafsari, anything to add there?
Yeah, no, and I think it's important to recognize that the immune system works through, as we've said over and over here, exposure, right? Exposure is how it learns to fight these things, and that's why we adults are nowhere near as sick as the average 1 or 2 year old whose immune system is seeing a lot of these viruses for the first time, and it really is remarkable that we've figured out through science something that only in the last really 100 years of human existence has been worked out that by exposing us to a dead virus, or modified virus that won't make us ill, that we can actually induce immunity. I mean, this has been extraordinarily life-changing for thinking about childhood. And to the point that people don't actually realize sometimes that this is precisely what vaccines are doing, that vaccines are literally training your immune system to fight against a disease that the vaccination is for. I want to share with you a rather hilarious tweet that went viral because it was kind of showcased the ignorance of the person who said it. This is a well-known individual online who said this publicly and he's been very much against vaccines and so on. And he said, "What if instead of a vaccine, we just were able to get exposed to a weak version of the virus that enabled us to build antibodies we need to fight the real thing?" That is literally what vaccines do. Um, I mean, really, people. Th- the anti-vaccine kind of mentality can sometimes be so strong that you get comments like this where they turn around and reinvent vaccines, which is what we already have. Um, so yes, I would just encourage people to think carefully about the information they're hearing because this is literally how vaccines work. That is actually the entire point. All right, key takeaways.
All right. So other than, of course, vaccines, I saw a comment. Somebody said his tweets made his rounds on TikTok. I think it made its rounds on every social media platform out there. All right. So key takeaways. It is impossible, completely impossible to avoid every illness. The only way for any of us to do this would be really to never have contact with any other humans, which is totally impractical, and our immune memory would never develop. And, we say this because getting sick is no fun. Nobody wants to be sick. But also just know that there's no way to avoid getting sick. And I know we feel crummy and it disrupts our work and it makes things difficult, but it's okay. It's okay to get sick because it's impossible for us to not get sick. Next slide, please. And it is normal and expected for children to get sick, which I think we've kind of reiterated over and over throughout this webinar so far. Their immune systems are learning, and they're going to get sick a lot while those immune systems continue to learn and that specific immunity continues to build up. Now, as they get older, their systems can better respond thanks to that specific immunity, which leads to fewer symptomatic illnesses. But I also think it's just really, really important for all of us to remember that this is normal and it's okay for kids who have some of these symptoms as long as they don't have a dangerous illness to kind of be out and about with other kids because no matter what, they're going to be catching things and there's so many viruses out there. Next slide, please. Illness is not a failure on society, families, or caregivers. So as early childhood care providers, none of you are failures if there's something going around in your child care center. And, families might get frustrated because their kids are getting sick when they're at care. And that's just kind of the way things are. Again, we need to remember immune systems are learning. It's normal for kids to be sick, and many viruses out there are not dangerous. Now, there's a couple situations where we could consider it a failure. And one of those is a vaccine preventable illness in an unvaccinated child. Measles is still very much out there. It's also very much vaccine preventable. But also an illness that should have been identified earlier, but the symptoms and the severity were ignored. And we're not talking about maybe somebody feeling bad because they let their kid have a fever for one extra day before they brought them in. We're talking about kids who maybe we've seen news stories of their suspicion of diabetes in a child. Well, then instead of getting treatment, the families are trying other measures that are not proven and are not working. And that's a very sad situation. Next slide.
And I'll just jump in before we move to the next slide that yeah, this is important to recognize. I see a lot of ill children when I practice clinically. Many we have no easy way to reliably prevent, and most are harmless. Sometimes I see something that is not harmless, but it's not something that we're able to we have no vaccine against yet or anything like that. But then when I see a child, for example, who ends up hospitalized with meningitis because they weren't immunized against strep pneumo or pneumococcus, just two different words for the same thing. And then I realized that the child was completely unimmunized. In that particular case that I'm thinking of, it had to do with not coming in for care because of fear of coming to the clinic during the later stages of the pandemic, where ill people are and so on, right? But now the child developed a vaccine-preventable disease that was completely preventable. We got them to the hospital in time and treatment started and all that. So luckily that one ended well. Those are things where we do have safe, easy, readily available options. And when they don't happen, we need to analyze exactly why.
And this was already mentioned too, but symptoms are the body's response to infection. So again, symptoms mean your immune system is working. So symptoms are a good thing. They're working on getting rid of whatever is foreign to your body. And the infection is present and the virus is multiplying before symptoms develop, which is really important for you to realize that people are actually contagious before symptoms develop. Next slide. All right, and kind of our final wrap up with this content here. There's a short quick tips for ECE providers video that two of our lovely students at ECHC created. And this one happens to be about contagiousness, so we felt it was an appropriate way to end.
Hello, and welcome back to Quick Tips for ECE.
We're so happy to see you again.
Today, we will be spreading all the news about, drumroll,
Contagiousness! Sending a sick child home might seem like it will protect your classroom, but will it really?
Oftentimes, sending them home will not protect your classroom as much as you think.
Many illnesses are actually contagious before symptoms show up. This means that a child is at risk of spreading germs to others before they even know they're sick. This child in the picture below might be sick, but we wouldn't be able to tell just by looking at them.
For example, the contagious period for the flu begins approximately 24 hours before there is coughing, fever, sore throat, or any other symptoms that indicate the child could have the virus.
Similarly, head lice can be present for 4 to 6 weeks before any itching appears. That's a whole month of lice being in the classroom before they are noticed. At that point, it does not make much of a difference if the child gets sent home immediately versus at the end of the day.
Children and adults can also be asymptomatic. This means they are infected but show no symptoms. They might not be throwing up or have a cough, but they're still spreading the illness around the classroom and to other children.
Additionally, different children can have the same infection but present with different symptoms. Child A might be coughing, sneezing, low energy, and always grabbing the tissues for their runny nose, while child B has the same sickness but is excited for the day, having fun, and just has a mild cough.
Based on symptoms alone, child A would probably be sent home, whereas child B would get to stay. That means one child gets sent home while the other gets to stay and spreads the same thing.
Back to the original question. How much does sending a sick child home help protect others?
We have learned that the contagious period does not perfectly align with symptoms. So, by the time a child develops symptoms, it is likely that many other children in your care have already been exposed. When you're concerned about a symptomatic child spreading an illness to others, there is a good chance that multiple other children have the same illness already.
Sending a child home from care may not prevent others from getting sick as much as you think.
We understand it can be frustrating that you cannot completely remove illness from your care. However, it is normal and common for young children to become infected with multiple viruses each year.
For children, most illnesses result in only mild symptoms and are self-limiting. This means that they will get better without treatment and should get better within a few days.
There are many common patterns with illnesses, but ultimately, each case is different. We can use the key exclusion criteria to help assess whether a child should go home.
Remembering the phrase arm will help with this process.
First, we have A. How is the child acting? Can they participate in activities, or are they uncomfortable?
Next, we have R for risk. Is the child at risk of spreading harmful diseases to others? Most diseases will take care of themselves with a little TLC, but very rarely there could be something more. If you are concerned that symptoms are worse than expected, encourage the family to contact their primary care provider.
Finally, the M for more. Does the child need more care than the staff can provide without compromising the health and safety of other children?
Coming back to the exclusion criteria and remembering ARM can help determine whether a child should stay or go home.
In addition, caring for our children has detailed rationales for inclusion versus exclusion.
We also have a health policy template wizard tool right on our website that can help you write a high quality, best practice based health policy for your center quickly and easily.
Overall, health and safety will always be the priority. However, make sure to assess the situation and your resources before sending a sick child home. As you just learned, by the time you're thinking about sending a child home, others in the class have likely already been exposed.
This means that sending a child home immediately might not help as much as you think.
It was a pleasure as always. Reach out if you have any questions.
I'm Dr. Depesh Navsaria, and I approve this message.
All right, folks. Hope you enjoyed that. We actually have a series of videos that our students have put together along those lines, that some of which are already on our website, and a couple more to come as well. They had a great time putting it together, and it was really fun working with them to really kind of hone the message and really make sure that it's accurate and as well as fun in terms of how we were able to convey it. So. I'm going to stop sharing here and just move around here. So, um, great. Kristen, Kelly, any other thoughts before we move on to questions?
I think I'm ready for the questions.
All righty, great.
Bring 'em
Well,
on.
I saw a few things already in the chat, and while we're going through those, please, folks, feel free to put things into the Q&A. Is easiest for us to keep track of, but the chat is fine as well, and so on. So I know we started off with a great question for you folks about myths that are out there, ones that you think may not be true or things that you know are true. Um, and I saw a number of things here. Yeah, this immune system resets itself every 7 years is not true. The some immunity is lifelong. This is why, for example, if you got measles vaccine as a young child and you're 60 now, you don't need a booster or anything like that. There's certain things, some immunity does wane in certain circumstances for some and some diseases, but not for all of them. Exposure, we covered a lot of that. Yeah, grape juice helps keep stomach bugs away. I'm not aware of any evidence that it actually does that. But if it means you'll stay hydrated, sure. Somebody mentioned take your vitamins. And as we talked about, right, good nutrition is important for your immune system to function normally, but it on its own, taking more vitamins will not make your immune system better after a certain point. And we've talked about that in some of our webinars and podcast episodes on supplements. Some folks have mentioned dirt. Yes. Dirt is composed of many, many, many different things. And there's a lot of antigens that would stimulate the immune system in different ways. And again, you may be exposed to things that would build up immunity. I'm not sure I'd give someone a bowl of dirt and a spoon and tell them to eat it explicitly, but a kid with hands that are grubby from playing in the dirt, I don't think it's the end of the world if you find them licking their hand or something like that. But it's not something I would encourage on a regular basis and all. Yes, you will catch a cold if you go outside with wet hair. That is completely untrue. Herbs may help the immune system. There's probably a tiny, tiny bit of evidence for certain specific ones, but nothing that is super strong. Onions on the feet draw out illnesses, definitely not. Um, Essential oils have not been shown to do anything at all, except maybe benefit the people who are selling you the essential oils. So there is some connection between the gut and the immune system. There's a lot of immune tissue around the stomach and intestines. What does that mean in terms of immunity? We're not really sure. So there's a lot of questions there. All right, scrolling in further from that point, some other questions we had there. I know I popped a few. So, oh, yes, there was one about breastfed babies being exposed to things that could be allergens, pets, food, et cetera, that could benefit the baby. That's a great question. I'm going to say it depends. Um, just because mom eats something doesn't mean that that stuff, the antigens from that stuff, are going to automatically show up in breast milk. It's kind of complicated and depends on what we're talking about. So the answer is maybe. Breastfeeding has been shown to have some benefit for immunity, but it's not actually as gigantic as people might assume. That transplacental immunity is actually much, much bigger than what happens from breast milk. So there's a benefit, and it's real, but it's not that large. I did see a question that got crowdsourced answered about hand, foot, and mouth disease. It has been around a long time. Most hand, foot, and mouth, looks like a pretty standard minor illness with a bit of a rash. And most hand, foot, and mouth tends to be pretty mild. So it probably wasn't being called that at that time. There's a question about helping parents understand that rest and sleep is important. You might suggest that they watch our webinar or our podcast on sleep. We have both of those, and you might share that with them. And then there was another question about hand, foot, and mouth, and the kids being allowed to stand. We covered some of that actually in our last few slides. That remember, contagiousness can often starts before symptoms have developed, and also hand, foot, and mouth disease is honestly less serious than a cold. So if you're okay with kids that have a bit of a snotty nose being in your center, which is frankly a lot of those kids, then hand, foot, and mouth disease shouldn't be treated differently than that. It is not a serious illness in the most in almost all cases. And we saw lots of questions about copy of the video. So this whole webinar, as with all of our webinars, will be archived on our website. And there'll be a separate copy of that last contagiousness video, if that's the one you're interested in, and so on. So I saw a couple of great questions about, so one, which I don't have an answer to, which is, yes, early childhood educators do not have appropriate sick days, support, et cetera, despite the exposure. Yes, we at ECHC cannot fix that for you. I wish we could. And I think that the conversations need to continue about that advocacy to ensure that as a workforce you're getting what you need. That's I think pretty key. Um, yeah, the adage, if you're sick, stay home, does that apply to young children? Again, it depends on all those factors we talked about. How's the child behaving? What is the capacity of the center to support that child, right? If they're mildly ill, then and just need, an occasional bit of extra attention. That's different from a child who's needing holding all day, which is not practical as well. And again, we've had webinars on and all on that topic as well. And all. Is herbal tea okay for babies to consume? So the problem is herbal teas depends on what's in it. Um, some of them may be fine, some of them may not. I would say that that's something to discuss with your child's healthcare provider, because that they could contain all sorts of things. Thank you. I see people are finding the appropriate podcast episodes and doing our work for us. We appreciate the live help. And Kelly, thank you for putting in that thing on nutrition and so on. Oh, okay. That was a lot of things I just answered at once there. Kristen, Kelly, anything else that you want to throw in on anything that I addressed?
I don't think so. I think that was a lot of good information, a lot of really good questions that everybody asked.
Yeah, I second that. Great questions. If there's any more, throw them in the chat.
Yeah, this came around about because we were discussing that the immune system is something that's not often well understood by lay people, and some of your early comments showed that many of you do have an understanding of many of those finer points, but we wanted to make sure we got everyone on the same page, um, and understand the complexity of the immune system, but also like how the immune system interacts with the world around it in different ways. Right. And I see a couple of things. With reduction in the funding for mRNA vaccines, do you expect children will be able to receive vaccines this fall? So, we actually have a podcast episode coming up in the next week or two about this. No vaccines at this time, at August 7th, 2025, as I say this, no vaccines have been banned or withdrawn uh, from use or something that can be prescribed or administered. The bigger question is going to be around funding. If the federal Vaccines for Children program, which covers at least half of vaccines in the country that are administered to children, if they stop paying for it, or if other insurance companies stop paying for it because it's been removed from the ACIP vaccine schedule, then that'll pose some challenges. Uh, Insurance companies could choose to ignore that. The American Academy of Pediatrics is doing a separate vaccine schedule, which, yes, gets confusing. They've wanted to avoid that for decades and have not. They always compromise on exactly how it should look because they don't want there being confusion. But with concerns about the um, quality of science and thought that's going into the ACIP schedule, the AAP said, we need to be clear about what is or isn't accurate, and will be doing their own. Time will tell what happens in terms of insurance coverage and all. I don't think anything is going to change that quickly, and I do think children will be able to receive vaccines this fall. I think the bigger threat, quite honestly, is families being exposed to mis and disinformation that is leading them to choose not to immunize, and that is creating all sorts of issues. For example, the national measles outbreaks that we're having in different ways. Nicole, infographics around helping communicate around immune systems and illness. That's a great question. There's almost too many things out there, and as Kristen just put in the chat, there's one that talks about communication. We'll also have some key takeaways from this webinar that we'll have available with the materials that we send out, and that might also be helpful for you to share with families. Right. Erin is putting in the chat about the post-webinar survey. So if you want credit for this, that is where you should go. There's an English and a Spanish link. So please make sure you do that. And ensure that you fill that out in order to receive registry credit, and also to tell us how you thought this webinar went. I have one more thing that I do want to say, but I just want to thank both Kelly and Kristen for the great work that they did putting this together and presenting it today. Thanks to both of you.